Cavities, also known as caries, are small openings or holes in the teeth caused by tooth decay. They form as a result of built-up plaque and bacteria on the surface of the teeth, poor dental hygiene, and a lack of essential minerals in the diet. In most circumstances, cavities are irreversible and will need to be treated by a dentist using fluoride treatments, fillings or extractions. However, new evidence is emerging which suggests that it may be possible to treat cavities at home, using a combination of diet and tooth remineralization. This video will walk you through both options, while also providing some guidelines on how to prevent cavities in the first place. Understand the signs and symptoms of cavities. It is important to be able to recognize the signs and symptoms of cavities as soon as they appear. This way, you can get a head start on treating them and prevent them from becoming larger and more painful over time. If you experience one or more of the following symptoms, you may have a cavity. Experiencing tooth sensitivity or toothache. You might also feel mild to sharp pain when eating cold, sweet or hot foods. You may feel pain when you bite down. You may notice dark-colored pits or holes on your teeth. Teeth may break or chip and expose a dark inner surface. Bad breath or taste in your mouth, especially after meals. Some cavities, especially those at the back of the mouth or between teeth, will be invisible to the naked eye and may not cause any pain. These types of cavities can only be identified through X-rays, ultrasound or fluorescent lighting, which is why it is important to see your dentist regularly. Visit a dentist. It is recommended that you visit your dentist approximately twice a year to get checkups on your oral health. However, if you suspect you might have a cavity, don't wait around for your biannual appointment. Make a date with your dentist immediately. Get a fluoride treatment. Fluoride treatments are used in the early stages of cavities, as fluoride can help teeth to restore themselves by remineralizing the tooth surface. The treatment consists of a gel varnish, liquid solution or foam fluoride which is used to coat the teeth and strengthen the tooth's enamel. Get a filling. Fillings, which are also known as restoration treatments, are used when the tooth decay develops further into the enamel and becomes permanent. The dentist removes the cavities using a drill, or the dentist may use a laser instead of a drill. Then the dentist fills the holes using tooth-colored resin material, porcelain or silver amalgam material. Get a crown. Custom-fitted tooth coverings called crowns are another way to treat cavities. They are only necessary when the tooth decay has become particularly extensive. The crowns are made of tooth-like material attached to metal, and dentists can also opt for provisional or permanent crowns, depending on the material used. A provisionary crown is made in the same appointment and it cannot be used for more than 3 months. Crowns are important for aesthetic reasons, gum line, and functionality. Undergo a root canal. A root canal may be the only option when cavities have penetrated deep into the tooth's pulp, and the inside of the tooth is decayed, infected or dead. Consider having the tooth extracted. If the tooth cannot be saved, have it extracted. The only option for cavities that have affected the entire tooth is an extraction. Your teeth are extracted if they are badly damaged and cannot be saved using any of the other methods. Brush your teeth at least twice a day. It is important to brush your teeth at least twice a day, as it prevents cavity-causing bacteria from building up on the surface of your teeth.
Remember to floss.
Flossing needs to be done at least once a day, ideally before you brush your teeth at night. Flossing removes bacteria and trapped food particles from between your teeth that your toothbrush is unable to reach. Use a mouthwash. Regularly using a mouthwash can help to kill bacteria, remove plaque, prevent gum disease and protect against bad breath. Have regular checkups. Visiting your dentist just twice a year can help you to get ahead of your cavities. Get sealants on your teeth. If you don't already have them, sealants are a good way to protect your teeth against cavities. A sealant is a thin, plastic coating placed on top of the back teeth to prevent bacteria and plaque from collecting in the grooves of the molar teeth and causing a cavity. Chew sugarless gum. Some sugarless gums can actually help you to avoid cavities, as chewing them increases saliva production, helping to get rid of food particles trapped between the teeth. Get enough calcium and vitamin D. Your body needs calcium to build bones and teeth, and vitamin D in order to absorb that calcium. Eat a varied diet that includes foods rich in these nutrients, such as dairy products and leafy vegetables. Taking vitamin and mineral supplements is another option. Use products that contain CPP, ACP. This chemical has the intimidating full name casein phosphopeptide, amorphous calcium phosphate, but all its components are found in common foods, particularly milk. There is good evidence that toothpaste, mouthwash, and sugar-free gum that contains CPP-ACP is extra effective at restoring slightly damaged tooth enamel. This is called remineralization. Treat dry mouth. Saliva helps prevent tooth decay. If you have a dry mouth, it may help to suck on sugarless candy, chew sugarless gum, and drink plenty of water. If your dry mouth is severe, ask your doctor for advice. Smoking, aging, various medications, and dehydration are common causes of dry mouth. If none of these seem likely, visit a doctor for a checkup. Deal with any pain. If you are experiencing a lot of pain as a result of a cavity, don't suffer in silence. You should schedule an appointment with the dentist immediately. Gargle with salt in water. Dissolve a teaspoon of sea salt in a glass of slightly warm water, take a mouthful and swish it around your mouth for a minute or two, concentrating on the area with the cavity-filled tooth. Replace the sea salt with garlic salt for another effective remedy. Swish vegetable oil in your mouth. Swish some vegetable oil around your mouth, then spit it out once it becomes foamy. This is meant to pull infection from the tooth and relieve pain. Take ibuprofen. One surefire way of temporarily relieving tooth pain is to take ibuprofen. This will reduce inflammation and relieve pain. Make sure to use ibuprofen according to the manufacturer's instructions.
लाइक शेयर और सब्सक्राइब जरूर करें, इंशाल्लाह आपके लिए बेनिफिशियल साबित होगा।